Welcome back to another edition of TCM Graduate TV. I'm Kent Scepsic, registered acupuncturist. This is episode 47, can you believe it? And today we're going to do the big bad stomach channel review. We've reviewed all the heavy hitters on the stomach channel. And I've kind of broken it down, wrote a list, and it looks like I use roughly 21 out of 45 acupuncture points on the channel. And that's just a little less than half if my math serves me correctly. So let's get into it. Let's review the entire channel. Let's check out what heavy hitters are on this channel. So the first one is Stomach 1. Do I use Stomach 1? You darn rights I do. And if you remember, I went on a little bit of a rant in regards to Stomach 1, and I said, I get tired and I abhor the fact that people call it a danger point, because all acupuncture points are dangerous acupuncture points if we don't use the proper angle, the proper setup, if we don't check our depth. All these things, they all contribute to making something very safe or very dangerous. If we don't wash our hands and don't swab our patient, things can get quite dangerous and we can cause a lot of problems and a lot of harm to our patients, which we don't want to do. So Stomach 1, if you're not comfortable using Stomach 1 and you want to learn how to use it, find a colleague who's very comfortable using it and very comfortable teaching it to you. So Stomach 1, using it locally for eye concerns. Now, before I jump into Stomach 1 and before I jump into UB1 and the extra acupuncture point Qihua, I'm going to use other acupuncture points in the area to see if I can get the job done without using such invasive acupuncture points. Not danger points, but more invasive and might be a little bit scary for the patient even. So Stomach 2 is a great acupuncture point that is an adjacent acupuncture point for eye concerns. Just the same as with UB1, sometimes I'll start with UB2 and I'll thread towards UB1, and that's a great way to see if I can get the work done with an adjacent acupuncture point. Next on my heavy hitter list is Stomach 3. While this might be used for nasal concerns, I use it more for Bell's palsy. Definitely using Stomach 4 locally for any mouth concerns. And again for Bell's palsy. Stomach 5. Stomach 5 is a great acupuncture point. Again, using Stomach 3 through 5, mostly for Bell's palsy concerns. I will have patients do certain tests when they come to the clinic. I'll have them raise their eyebrows as far as they can go, so I need to know, because I need to know if there's any local acupuncture points above the head that I need to use. I'll get them to smile big. I'll get them to puff their cheeks out, and I'll get them to stick their tongue out to see if it's deviated at all. And with Stomach 5, of course, we follow the ridge of that puffed out cheek, and what'll typically happen is they'll push their air out and it'll start to escape on one side. We need to know that that area is of concern, and we want to give that muscle and that nerve some tone. So we're going to follow that puff all around, and it's an absolutely great acupuncture point to help Bell's palsy. Now, Stomach 6 and Stomach 7, I definitely use both of them, but I group them together. If you recall when I talked about Stomach 6 and 7, I use them together for TMJ. A symptomatic grouping would be to use Stomach 6, 7, and Large Intestine 4. And you can get more of those symptomatic pairs on my book that's coming out, which is due January 15th, 2018. Start shipping, and that's soon. So, Stomach 6, 7, really good acupuncture points for TMJ. Stomach 8, definitely using it, but first we're gonna erase this, take a sip of tea, and we'll be right back. All right, we're back. So Stomach 8 is definitely on my heavy hitter list for headache. and I abbreviate headache with HA. Typically, we treat headache due to phlegm. So if you look in Maciocia, you look in Deadman, stomach aid is used to treat headache, especially when there's phlegm involved. We can also use this for hair loss, especially in the corner sides of the hair, if it's due to blood deficiency and alopecia and that sort of thing. Moving right along to stomach 9. I love stomach 9 for any hoarseness of voice, loss of voice, or any sore throat. There's other acupuncture points that we definitely can use. I usually ask the patient where they have a sore throat. If they have it kind of in the back of their throat at the base of their tongue, Ren 23 is really, really good. If they have it in this area, I'm definitely going to use stomach 9. If they have it more along the sides, I'm going to use SI 16. And we compare these with lung 7 because it's a key or command point for the head and neck. Mostly the posterior neck, but it'll help out regardless. So stomach 9, great acupuncture point. Again, a very safe acupuncture point. I talked about in my videos. If you go back to a previous episode, I talk about how to needle this. But again, I'm really, really big. You need to learn how to use it and be comfortable using it in the clinic under supervision or with a colleague who's comfortable with it. So find somebody and get good at these danger points. So stomach 9, not really using stomach 10, not really using stomach 11, definitely using stomach 12. So stomach 12 is one of the 6 contraindicated acupuncture points in pregnancy. And we had a really great discussion on Instagram when I posted the 6 contraindicated acupuncture points, because different provinces, different states, different countries even have different standards. So if you're about to write your licensing exam, or you're about to move to some place and you maybe need to redo an exam or integrate with that community, you want to find out what people regard as contraindicated acupuncture points for pregnancy. Stomach 12, I use it after 37 weeks. So once I get the green light that baby is full term, medical doctor, OBGYN is okay, midwife is okay, and considered full term, and we want to kickstart that birthing process by releasing some oxytocin, by causing mild contractions, ripening the cervix, stomach 12 is definitely one I'm going to use. And it is, again, a very safe acupuncture point if used correctly. 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, not using them so much. However, definitely using stomach 25. So stomach 25 is the front mu of the large intestine. And I talked about in this video, when I made the stomach 25 video, about how some people like to use stomach 25 more for constipation and they like to use spleen 15 more for diarrhea and vice versa. However, I use stomach 25 for constipation or diarrhea. It's a really great acupuncture point for regulating the large intestine function. And if you've got somebody who's got really severe constipation, of course, we've got our triple warmer 6, kidney 6, stomach 25, Ren 6 kind of symptomatic pair combo. And the other thing you could obviously do is you could pepper all of them, if you will. You could do kidney 16, stomach 25, spleen 15. That would really get things moving. However, stomach 25 with the symptomatic pairs of triple warmer 6, kidney 6 to help promote more water so it can float the boat out. That's kind of the metaphor used in Chinese medicine. Is excellent. So stomach 25, really good acupuncture point for any digestive concerns. 26, 27, 28, maybe 29, but I'm definitely using stomach 30. Stomach 30 is great for any genital or that, inguinal canal problems or that area, because it's really great for hernia. So if you've got a male and or female patient and you've got concerns in the area, you definitely can use stomach 30, but typically it's used for hernia. Stomach 31, not so much, but definitely using stomach 32. So stomach 32 is great for leg and or sciatica problems, especially if you have sciatica that's kind of wrapping itself around the front of the leg and you can't figure out, it's not really the gallbladder channel, it's not really urinary bladder channel, but it's wrapping itself a little bit around the leg. Stomach 32 does an amazing job of taking care of that for you. And when I was talking about the four, there's kind of 4 standard key or command points that are taught in school. And if you're in China, there's 6. And that's my very first 4 TCM graduate TV videos that I ever did. And we talked about the key or command points there. And we had a really great discussion on Instagram when I posted the 4 key or command points. And somebody pointed out that they were taught that stomach 32 is absolutely excellent, and they were taught that it was a key or command point for the leg. And I would tend to agree, because anytime that I've got some kind of thigh, leg pain or concerns that are maybe not doing the best with treatment, other treatment options, I throw in stomach 32 and it helps me get over the hump. It's absolutely wonderful. And of course, stomach 32 is part of the internal dragons protocol. And I just recently did a video on the internal external dragons, as I had a viewer ask me a question about it. So if you want to learn more about that, you can go back a few episodes and check that out. So stomach 33, not so much. We're definitely using stomach 34, but first I need to erase all this. And we're back. Stomach 34. Stomach 34 is a Shi cleft acupuncture point. Cleft points are typically used for bleeding or pain. If they are on a yin channel or affect a yin organ, they're mostly used for bleeding, such as lung 6. If you've got it on a yang channel, such as here we're talking about stomach, it's mostly used for pain. So if you have a patient and they have acute stomach pain, stomach 34 is going to help. I typically use it more so for an adjacent knee pain acupuncture point. Of course, we're using stomach 35 because it is part of the Shi-Yan grouping. Extra lower extremity 5 is the standardized notation, and that is part of Shi-Yan, the knee eyes or the calf's nose, depending on how you want to translate that. So stomach 35, excellent for knee pain. Stomach 36, the best tonification acupuncture point on the body. Absolutely amazing. So it's a key or command point for abdomen. It's a He point. And remember that He points affect the organ directly, so it tells the stomach to get its poop in a group, get your stuff together, so it doesn't matter what's going on with the stomach. He points just say, fix yourself up, right? Go get a shower and shave and fix yourself up. Stomach 36, so key or command point, abdomen, He point, best tonification in the body because it tonifies spleen and stomach chi. Moving right along, stomach 37, not so much. Maybe stomach 38. Stomach 38 is kind of a funny one. It's empirically known to treat frozen shoulder, and empirically means by experience. So some people's experience is that it helps with frozen shoulder, and some people's is it doesn't help that much. So stomach 38, definitely want to mention it because if you write an exam, or it's kind of well known that it is good for frozen shoulder. Stomach 39, not so much. Definitely using stomach 40. Stomach 40 transforms phlegm, and I like to pair it with spleen 9, which drains damp. Every everything from stomach 36 down to stomach 40 are absolutely excellent for compartment syndrome. So I've seen quite a few military patients and they have to run with packs on their back and a bunch of equipment and they get what's called compartment syndrome. And of course, any tibialis anterior pain, maybe somebody gets shin splints they've taken up after the snow melt, they take up skipping rope outside or something like that. Maybe you've taken up boxing for the first time and they make you skip a lot. So this is excellent for shin splints and that sort of thing. So right from 36 right to 40, I use all those. Going to erase this and we're going to finish out our stomach channel. All right, so we just finished up with stomach 40, on our way through stomach 41. I like stomach 41 for generalized ankle and foot pain. And what I mean by generalized is typically a patient will be able to come to you and tell you that they roll their ankle towards the outside and they have pain on the lateral side of their ankle and it's pretty much at GB40. So you put a pin at GB40 or you put a pin at UB62 or maybe both, and over a few treatments they start feeling wonderful. Or they'll be able to tell you that they tweak their knee and the inside of their ankle is quite painful and maybe a kidney 6 takes care of it, and maybe you have to do a little bit around the tendon, the Achilles tendon. However, if somebody tells you that they have generalized pain all over the ankle or generalized foot pain, stomach 41 is very good. I'm meaning non-specific. Moving right along is stomach 42. We have a lot of stomach acupuncture points on the face, and the hand mirrors the face, and so does the foot, according to I Ching acupuncture and mirroring style acupuncture. So what ends up happening is we can use channel to channel pairing. So we're using stomach 42 to treat any facial concerns, especially again, Bell's palsy. Stomach 42 is also very good if you have a patient that's maybe has some arthritis in their foot. They might have a little bit of an extra bone growth that's happening on top of their foot. I find using an acupuncture point on or around stomach 42 helps relieve their pain. Maybe surgery's in the works, maybe surgery's not an option, but typically when a patient will have that, then they will get extra, again, bone growth, and it'll push and it'll rub against their shoe and they'll be in a lot of pain. So I've helped lots of patients with this one using stomach 42. Stomach 43, not so much. And the last acupuncture point on the heavy hitter list is stomach 44. If you recall from my last episode, I had 2 supervisors come out and tell me that stomach 44 was good for cold sores. And of course, it's a spring acupuncture point. It's the second last acupuncture point on the channel, which makes, from the fingertips and the toes, makes it a spring acupuncture point. And if you recall, spring acupuncture points are great for where there's heat due to yin deficiency. So you can use them just for heat, but if there's a yin deficiency as well, so if you have heat and stomach yin deficiency, this is excellent. So there's all, I believe, 21 out of 45 acupuncture points on a stomach channel that I use because they're heavy hitters and they get a ton of stuff done. Just want to remind you that safety is king, bedside manner is king, and results are king in that order. Thank you so much for watching this big bad video, the mega review. We'll see you on the next video.